Hey, good afternoon, everybody. Hey, thanks for joining us. Really appreciate it. Good to see you. Sorry we missed you last month. We were at the Georgia MemoryNet Summit towards the end of the month, and so nice to pick up here again in July after having missed June. Have a treat for you today. It's a conversation with one of my favorite people. It's Rebecca McIntosh. So we're really excited about that, and we're going to use some audience response system, and so we'll get you to that in a second. But today, what we're going to do for the month of July is have a conversation on the development and growth of Georgia MemoryNet, celebrating, Rebecca, I believe our 5th birthday. Is that correct? So 5 years old. And so a lot of things to talk about and some review and things like that to kind of let you know what's up. Here's the disclosure slide. Oops, hold on. Sorry about that. Here's the disclosure slide. It's all my stuff. It's not Rebecca's fault. And so I do some consulting for pharma. I do some writing. And none of that really has much to do with the funding and work that we do with Georgia MemoryNet through funding through Department of Human Services. And so these disclosures are provided each and every month, but not really relevant to the content that we're talking about today. Hey, so we're going to use an audience response system. And so if you're inexperienced at this, there are 3 ways to do it. Maybe you have a computer screen that's available and you can type into the browser window pollev.com/baldheadted. So baldheadted is where I keep all my questions. You can scan the QR code that you have right there in terms of just using that QR code. That will allow your smartphone to go right to this location. I know a couple of people are joining right now, so I'm going to leave the screen up again. Again, we're using an audience response system today, so would love to have your participation. You can scan that QR code. You can go open a browser window and go to pollev.com/baldheadted. Or if you are one of the people using a flip phone, and there are people out there using flip phones, you can text baldheadted to the number 22333, and that'll allow you to participate in several different types of our questions, but a smartphone or a computer will allow you all different types of participation. So thanks for joining us, and glad that you could do this with us. So here's the first question. It's just a practice question. It doesn't have anything to do with memory loss or cognitive impairment or our max, but here we go. Oops, sorry. I've got to clear the responses. Oh my gosh. All right, so let's just add on to these. It seems like some folks came in early and texted their response. So what is the name of my daughter's dog? This dog loves the water, is a beautiful dog just by her head there. What would you name this dog? Would you name this dog Nash, Rookie, Decatur, Biscuit, or Cooper? Let's see how many responses that we've got. All right, Biscuit is coming into the lead as a name. Oh, there we go for Decatur. Way to go, Decatur. And all right, this dog's name is Cooper, and I can't be more disappointed. You all named this dog everything but Cooper. Thank you, Agnes. There's an E for Cooper. I appreciate that. If you're having trouble, just go ahead and throw it in the Zoom chat. So thanks. This dog's name is Cooper, but I thought that Biscuit was a better name for this dog than Cooper, but my daughter doesn't think so. All right, let's go to the next question. I'm going to start and ask Rebecca McIntosh some questions just about Georgia MemoryNet, someone who's been there from the start, someone who has a political science master's degree, so she's well prepared to navigate aspects of this. Rebecca, I invite you to call me Ted back. So my question for you is, could you talk about what Georgia MemoryNet means to the Georgia Department of Human Services and to Georgia legislators?
Yeah, absolutely. Thanks a bunch, Ted. And yeah, that political science degrees taught me to study politics and be on the periphery, not to be a politician. So that's a really great question. You know, and Georgia has a really interesting history and a really exciting future with regard to what we're doing with Georgia MemoryNet and just broadly dementia care and dementia care advocacy in the state. So up here, there's a picture of some key legislators, and of course, in the middle there, our former Governor Nathan Deal. And really, this was born out of personal experience from the legislators' perspective. The gentleman there on our left, looking at with the beard, is Chairman Terry England. He's the outgoing outgoing chair of the House Appropriations Committee. And he speaks about this publicly, so I'm not saying anything that's not open information, but his mother battled Alzheimer's disease and eventually passed away fairly recently. And he really took the experience of his mother, of him and his family to heart. Right about the same time, we're starting to see some trends with data in the state as far as the growth of rates of Alzheimer's disease. And I think we might touch on that a bit in a different question, part of the discussion. But Chairman England really took this to heart. At the same time, Governor Deal's wife was chairing an Older Adults Council. That was part of her personal mission as First Lady of the state. So there's really nice ties there as far as advocacy and caring for our aging populations and folks who are developing Alzheimer's or other dementias. And then right about that same time too, there was a legislator who recently had to step away from his duties after having moved from mild cognitive impairment into earlier phases of dementia. So the legislature as a whole was really feeling and seeing these impacts. And they didn't take this just as this is my experience. They understood and knew, and especially Chairman England and our other champion senator, the former Senator Jack Hill, late Senator Jack Hill there on the right, knew that this impacts everyone, right? And that if they're going through the struggles and seeing the barriers that they have in pretty, privileged positions of knowing resources and having access, then, oh my gosh, what about all of our other communities that don't have as great of access, be it because of rural literacy, race, other social determinants of health that we know really can negatively impact people's access to services or even availability of services in the first place. So coupled with, I think this was the picture of Governor Deal signing the state plan. You can skip to that next slide, Ted. So it was sort of a coupling of understanding from a public health and a data perspective with these very personal experiences, along with a lot of advocacy from really wonderful partners, Alzheimer's Association, COAGE, all of the academic institutions in the state, all sorts of other advocates, forming a state plan around how to address Alzheimer's and other dementias that was finalized in 2014, and then eventually pushing towards this 2017 GMN was born with an actual meaningful budget line item, some very specific and targeted objectives to bring access to services, diagnostic services and community-based services and supports for our patients. So really means a lot on that personal and the public health level.
Thanks, Rebecca. We're going to go to an audience response question, and I re-put in the instructions in case you joined late. You wouldn't have seen the instructions in the chat, and so here's how you can. Here's how you can find us. You can go on a computer to POLLEV.com/baldheadted, or you can text a message to baldheadted 22333. If you want to just put something in the chat, Lori will ask her to just put whatever's in the chat into the poll everywhere, and we'll see responses. And so this question just asks you to go ahead and type something to us. It's not a word cloud, but rather you can type in a complete sentence, a couple of sentences, an idea that you have. So what is the most urgent need for your patients or for your community regarding dementia diagnosis and or care? So we welcome, looking forward to your responses. Just making sure that everybody's seeing that opportunity. Or is it still showing the picture of my daughter's dog? Nope. Okay, great.
I'm seeing caregiver services in the chat. That's huge.
Yeah, agreed. That's one of the principal functions of Georgia MemoryNet, and also a really important thing. Expert clinicians receiving a diagnosis, caregiver support, community services, caregiver support, getting guidance post-diagnosis, agree about that as well. other thoughts that you have. Part of my clinical work is working with the Integrated Memory Care program here, led by Dr. Carolyn Clevenger and Laura Metters, who we offer a lot of caregiver support in addition to medical advice. Mm-hmm. Thank you, Christy. Caregiver support again. You can keep adding information in there. It will be seen by us later and helpful information to have. And Rebecca, I wanted you to maybe talk about this figure a bit. This is an opportunity to sort of match that need with what we're trying to do and look at some of our outcomes. So thanks to Reckon for their help in putting together some of these infographics, and maybe you could walk us through this one.
Yeah, sure. So I mentioned earlier, we all became very well aware as we started collecting more data around the need in Georgia. We have a rapidly aging state. I don't know if this is still accurate, but at one time we were, I think, the 8th or 9th fastest aging state in the nation, which is pretty big. We also are outpacing the national average for people living with dementia or who have a diagnosis of Alzheimer's or related dementia, outpacing by double digits percentage points of the national average. So really an acute need here. I think one thing that really stands out, at least to me and to a lot of my colleagues in DPH and Alzheimer's Association and across our partners, is this 385,000. So this was taken, I believe, from 2016 behavioral factors survey, statewide, 385,000 adults over the age of, I believe the cut point was 50 for that figure, indicated that they were concerned about their memory or their cognition, the self-reported cognitive impairment. And of those 385,000 people, 80% had indicated that they had not spoken to a provider, which is really, really distressing, right? Because then it's a fear or a stigma or availability of service, or again, that access to services. So really trying to move the needle on, addressing all of those things all of at once. It's kind of a bear of an issue to tackle, but we've got multiple partners working on it within the framework of that state plan, and hoping again to move the needle also on the 6-year average delay, right? Again, is it fear, stigma, availability, or access to services? What we see, and this isn't a pinpointed 6 years, it's just sort of the average sort of estimate of where people are in their disease trajectory. And that's normally when something more urgent is happening. You're seeing behavioral issues or wandering, or somebody's spotting issues with driving, or a lot of times, back to those caregiver services, it's when the caregiver has sort of hit the limit of what they're able to do on their own and finally are reaching out to seek help. So really trying to get ahead of the curve, that early diagnosis, an accurate one at that, which will be ever more important for therapeutics coming down the pipe in the next few years. This 2 billion figure is what we estimate. We pulled some data with our partners over in Medicaid and other state partners at DHS, but looking at just skilled nursing facility placements, ER data, inpatient data, how much could we prevent, early skilled nursing facility placement, multiple ER visits, things like that, which would shift those funds on the Medicaid side, potentially funnel back into community services. So form that loop is the ideal where we'd like to see that go, and what this slide's telling.
Great information, and we have access to CMS data in order to begin to look at some of these avoidable or unnecessary expenses. There's so many places that we want to spend money, and we want to spend that money smartly. Yeah. There's the next slide shows us a little bit about where memory assessment clinics are, maybe a bit about the structure of the memory assessment clinic. And of course, I recognize that this is a list that's growing and changing. So I invite you to talk about what's happening next.
Yeah, it's very, very exciting developments. So these are 5 memory assessment clinic, original memory assessment clinic team partners, still very much engaged with us. So the whole deal, Georgia Memory does, we don't have many neurologists who are very specifically trained or providers who have the time or the tools like psychometric testing resources, MRI interpretation, lumbar punctures that you need to get to that specific diagnosis. So what Georgia MemoryNet funds are used to do is go out and train other teams who are not necessarily cognitive neurologists or even neurologists on how to do those workups, provide them the resources they need for psychometric testing, MRI interpretation, and what have you. And then also embedding a community services educator, which is sort of a social worker light, I guess you could say, that offers bite-sized education and information, but really is linchpin to the facilitation of transition from that clinical setting in the MAC to the community services with the area agencies on aging and Alzheimer's Association. So this whole infrastructure is built around that transition point, as far as making sure that people, once they leave that clinic post-diagnosis, have those resources in that ongoing loop. This past year, we were able to successfully put in a proposal for expanding the Georgia Memory Net. So in addition to these 5, and I think we can skip to that next slide, Ted, the agency, so we've got all of our state agency partners. I kind of talked through that. Maybe the next one after that has the program expansion. I got ahead of myself in my slides there. There we go. So
I moved your slides around, Rebecca, so it's not just you. It's the team. It's the team that had a flub up there, and so you're on target right now.
Great, thanks. So like I said, this year we were able to successfully put in for an expansion, increase the budget, 2 additional bricks and mortar MACs to cover geographic regions. We're still working with the state and with other partners of where exactly those need to be. We will be doing an RFP process to make it nice and fair, equal playing field for new institutions, healthcare agencies coming on board. It also is, ramping up our engagement with DPH, building out telehealth and more services and supports directly for primary care providers, right? So not only do we have more resources going towards awareness on the front end of screening risk factors, how to refer, but on the back end, that really important piece of how do we better support our PCPs in the longer term care management, not mentioned on this slide, but extremely important also, simultaneous with our specific GMN expansion was a line item to the Division of Aging Services to place dementia care specialists in each one of our area agencies on aging. I believe there'll be 2 in the Metro Atlanta Regional Commission, just population density, workload reasons. But those dementia care specialists embedded in the AAAs are going to be really key to facilitation of those transitions, working really closely with our MACs, data collection, and then also attending to the needs of people who maybe aren't coming in specifically through the GMN pipeline, right, but that need those services that we can offer, that DAS and AAAs can offer to all of our patients. So really, really exciting expansion and movement all around.
That sounds great. And the first 5 MACs were key medical school partners across the state. And so that's the Albany, Augusta, Atlanta, Columbus, and Macon, either a medical school based there or a medical school extension in those areas. And this RFP gives us a chance to reach out to additional medical school locations and or community partners. So it's really exciting. Yeah. You get to take a deep breath because the next slide I get to talk about. So thank you, Rebecca. And so, one of the things that we've talked about in terms of memory assessment clinics is that second of 3 goals with regards to Georgia Memory Net. So we're very interested in having memory assessment clinics modeled after the Alzheimer's Disease Research Center patient-facing clinic of the Emory Goizueta Alzheimer's Center. We want to replicate that so that people get dependable, reliable, early and accurate diagnoses for their cognitive impairment, for their loved one, for them as a patient. And so that's that middle part, that early and accurate diagnosis. On the first of the 3 goals, since memory assessment clinics was the second, the first one is to work with primary care providers across the state to increase awareness of and screening for memory loss and other cognitive impairments. So we want to rely on the Medicare annual wellness visit as a mechanism by which to fund this activity. The Medicare annual wellness visit requires a cognitive assessment. We think that the mini-cog is a great tool that can be easily taught to staff members in a clinic as well as providers, and gives you a good screening tool to start that. And finally, the third goal is to develop and deploy a robust infrastructure for comprehensive program evaluation, patient-level data capture, and statewide impact. And so we've got a slide upcoming about that. But those are those 3 goals. So if I hit the advanced slide, it will go to our next poll question. But just in case folks didn't have the opportunity to find the instructions or the QR code that they can directly scan to participate in Poll Everywhere, in case you joined a little bit late, here's an opportunity for you there. That scan will take you right to the audience response system, or you can go to pollev.com/baldheadted, and that's how we're going to get your responses. So let's go ahead and go to our next question. So our next question is, we talked about the primary care provider and the primary care provider access being that first level of impacting upon what happens in the state. And so here's an opportunity to have a word cloud. So maybe 1 or 2 or 3 words that will allow you to answer this response. What can GMN do to better support PCPs? It may be outreach, it may be recognition, it may be awareness, it may be education, it may be training, it may be so any 1 or 2 words that you want to put in there, and let's see if we can come up with some common answers amongst you. So again, what can GMN do to better support PCPs? Great, and we're going to see different colors for your responses, and unless you're having the same response. Education, training, other things that we could do to support PCPs. Information and education, buy-in. I love buy-in. So we'll talk a little bit more in one of our next engagement slides about what we can do to think about buy-in and what type of buy-in we actually might mean. Training. Education with a hyphen and education without a hyphen. It's so funny, these word clouds are a little bit less than smart. If you put an extra dot at the end, it thinks it's a different word or term. Information. Thanks. Other ideas that you have. We'll spend about just 30 more seconds on this slide right here. One of the things, this is kind of a sort of a meta question. We're talking about education and training, and we're all here on GMN Insights, right? And so this is one of our outreach opportunities. We're about 8 sessions into this. We're working on packaging past sessions so that you can have little educational bites if you weren't able to stay for the whole half hour. Training, knowledge, buy-in, information, education. All right, thanks for that. You can keep adding to this word cloud and we can go retrieve it later. And so billing. All right, information. I like that. So if you happen to be still typing out and sending something, that's okay. We'll catch up with that later. And Rebecca, now that you've caught your breath, back to you. We'll give you a question just to talk a little bit about the whole structure of how we make sure that we're doing the best thing day by day and making sure that we use that information to improve what comes next.
Yeah. So if anybody on the call has ever done program evaluation, you're probably kind of excited or maybe, really eyeing this slide. But for the 99% of you that aren't such data nerds, this basically is a high-level overview of all of the different data points and points of information, points of handoff that we possibly can measure. And there's probably things that are missing from here, but really looking at our evaluation framework is sort of designed on a socio-ecological framework, right? So meaning everything from the individual up to population health, systems operations, health economics, and everything in between. So what is, the basic discrete data elements from a patient, so we understand who we're serving, how they're serving, what their diagnoses are, all of that very individual level information, as well as, very importantly, satisfaction and experience with the program. We've got teams who are drilling down very specifically into what is the patient experience and is it good or bad, to include access to the services. Then doing that same thing at the care team level. What's the knowledge, skills, abilities of our providers? What's their engagement and satisfaction with the program? How well are we supporting our PCPs? How well are we supporting our MAC providers? We're saying we're going to train you and help you do this stuff. Are we holding up our end of the bargain while you're seeing these patients? Looking at the community level, what's our utilization of services that we're plugging people into? And if there's gaps, we're just now getting enough information and have seen enough patients to where you can just now start digging in of who's accessing what services. If they're not accessing services, what are those barriers, and are there things we can do in partnership, we being the whole of Georgia Memory Net, all of our MAC teams and the area agencies on aging, Alzheimer's Association, what can we as a GMN do to help bridge those gaps and break down barriers? And so really, I think the takeaway and what I kind of want to get at is we look at as many points of contact as possible, as many potential points of failure as possible, and look at what's going really well and use that to drive forward our program and have iterative improvement just constantly.
Thanks so much. I'm going to skip over 2 slides, but they really build off of what you said in this slide. One of those is a state Alzheimer's disease registry, which is really important in terms of capturing this important work that we've done and sharing that in an appropriate and meaningful way to achieve our objectives. And the other slide that I'll just pass over is, some of our work on GMN telehealth implementation. But do you want to maybe say just a couple of words? We've got 2 counties that we're working on as part of a hub and spoke.
Yeah, sure. And I think in both of those slides with the Alzheimer's registry and some of the telehealth stuff, it really speaks to the amazing partnerships that the Georgia Memory Net and the state plan has opened up for cross-institutional collaboration, right? So the ADRD registry and a lot of the work with the telehealth live in DPH, but they're directly connected now with DHS. And, GMN in some way kind of helps form some of that glue along with other activities and engagements. So bringing everybody in with the telehealth, we had the opportunity 2.5 years ago, about a month after COVID, when the first CARES Act funding came through, and the former DAS director had a great idea of using some CARES funding to purchase iPads to facilitate telemedicine for people who don't have broadband or don't have the hardware in the state. DPH was really quick to offer up, hey, we could use public health offices. We've got reliable internet. We've got staffing there who can help make sure these remain safe and private office visits. There's other ways we're looking to use those iPads as well, but those DPH pilot sites in Dooley and Emmanuel County will be standing up and starting to see patients soon, which is really exciting. Those are 2 areas with low internet, high aging populations. And so hopefully we can open up some services for telemedicine visits with our MACs there.
Going all the way back to a slide that we showed earlier, one of the goals of the state is to have access to memory assessment services that might be somewhere between 60 and 90 minutes away. So this opportunity to, not only build brick and mortar outreach posts, but to use available Georgia DPH resources where they have telehubs and spokes out in these counties is really an opportunity to get really close to folks. And, this is one of those good effects of COVID in terms of, we've figured out a lot about how to do some of the telehealth work that seemed to be a real mystery before. Rebecca, I'm going to hop all the way forward to slide 17, which just shows kind of the process of how the primary cares work with the MACs, work with the community services. And if you just spend a minute on this slide, then I'll lead that into our next question, which is, with this process starting at PCPs, what is it that triggers PCPs into sending patients to MAC? And we'll get some audience response on that. But your thoughts about this slide, please.
Yeah, absolutely. So, the GMN model is meant to be a way to open up access to those diagnostic services. We understand, though, that if we were to have continuing follow-up care for every single patient, then the diagnostic clinic visits would be reduced. So that's why we have this 2-visit model that you can kind of follow around the circle there. And that first visit is really all about the baseline assessments, neuropsych testing, imaging, occurs after that, your first workup with the doctor. Second visit is all about goal setting for the patient and their care partner, right? So now we've analyzed all the information from baseline, understand the diagnosis, and now creating care plans that are patient-centered, creating goals for home life and what have you. And then at the end of that visit, of course, having those referrals automatically, unless a patient refuses, automatic referrals to the area agency on aging that's local to them, as well as to the Alzheimer's Association. For patients with Lewy body, we have information and connectivity with the Lewy Body Dementia Association, and same goes with FTB in certain groups. So trying to make that pretty targeted. And that's where that handoff then also happens back to the PCP for longer term care.
Rebecca has said a lot, and she's also written it all down. And so one of the things that you can think about is that this is a free publication available to you. All the information about the establishment of Georgia Memory Net appeared in a copy of the Journal of the American Geriatric Society. It got a good readership and actually an invitation to a national conference to talk about this work. And so Rebecca's one of the first authors, along with Dr. Alexis Bender, and certainly indebted to all the other authors that appear on this. If you QR code, this will take you directly to where you can download it. And so encourage you to read more about Georgia Memory Net. Just to finish up, we're going to send you back to, hey, look, if you wanted to scan in and do audience response, we've got one more audience response for you. And that audience response is this question. So this is an interesting, involved question. And basically, rather than picking an A, B, C, D, E, or F, you basically sort these into an order and then hit send. So if you are thinking like we are thinking about how to best cement the connection between primary care providers and our GMN MACs, how do you do that? What are the things that matter most to a primary care provider? Is it that it's an accurate diagnosis that matters? Is it the primary care provider believes that early diagnosis matters? Do they need to have a personal relationship or a confidence in the MAC consultants? Is it convenient for the patient and the patient's family? Is the patient's interest in, I want to know more about this, really driving it? Or is it something else that we just haven't listed up here? So you can sort these into an order, and as soon as you hit send, it's going to start populating and ranking these from 1 to 7. So just need one person to get us started, and then the second person that comes in will actually resort this. So this is advanced audience response, people. So let's see what you got for us.
Did you get the paid version, not the free trial version of Poll Everyone?
I got the paid version. I got the paid version. This is as an Emory University faculty member, you too could have a free version of Poll Everywhere that has all the features added. All right, people. So we're just interested in one person hitting send, and it'll resort these. Rebecca, while we're sitting here waiting, I just wanted to express my appreciation and thanks for all of your leadership during this 5-year journey with Georgia Memory Net. Thanks for joining us today. And we're beginning to see some answers here. So let's just look and see how this sorts out. All right, so the next person that hits send is going to resort these in a different way. So welcome you to do your own work and then hit send and look what the impact is across the group. So primary care providers have to believe that an accurate diagnosis of dementia matters. Like, what subtype is it? Is it one of the main 4 types of Alzheimer's, vascular, Lewy body dementia, or frontotemporal dementia, or a mixture, or a predominance of one type of amnestic or language? And does that really matter? Belief that an early diagnosis is important. That's got to be the next thing that happens. The patient has to be interested in this. Confidence in MAC consultant. Okay, so things are moving around a little bit. Encourage you to go ahead and hit send. It'll resort these things for us. Still, we have number 1 is a belief that an accurate diagnosis of dementia matters. That's one of those things that's coming out, and it's going to be more and more important as different things come down the therapeutic pipeline. And so that will change things in terms of, hey, look, it matters if this is Lewy body dementia or Alzheimer's dementia specifically, or vascular dementia.
Mm-hmm.
Interesting, a personal relationship with MAC team members is sort of sorting down a little bit lower. And so that's helpful information. Patient's interest in knowing answers is still really important. So the patient's value in that matters.
Mm-hmm. Yeah, it's interesting that I'm finding these top 3 are in a very similar vein to me. Well, what was the top 3? Now it's resorted, but the patient interest, belief in the accurate diagnosis, and the early diagnosis are all kind of lumped in my mind.
Yeah, confidence in MAC consultant is going up a little bit, but early and accurate diagnosis has got to be important to the primary care provider in order to hit that send button. Mm-hmm. I'm going to let you go ahead, and if you haven't sent your answer in, we will have the opportunity to see that later. I'm just going to go to one more slide that we have. There's a lot of information on the line, online about this at georgiamemorynet.org.
Mhm.
And you can write to any of us to figure out how to get in touch. And I'm going to finish up and send it back to Lori Beth in terms of the last slide that we have today, which just sort of takes us out and gives you a chance to do a QR code or scan. Lori Beth, if you could just throw that quick link into the chat so that people could just go straight to that chat, go straight to that online source, or you can use your QR code to do that. Lori Beth, words that you have to take us out today?
Just want to thank you, Dr. Johnson and Rebecca, for talking with us today. And thank you all for joining us. Please fill out the evaluation survey so that we know how we did, and also to receive CME credits. So this series is approved for CME credits. And we look forward to seeing you all next month on August the 17th. So again, thank you all.
Signing out on minute 36 of our 30-minute seminar. You all take care. Have a great day.